Hi, I'm Dr. Talorico. I'm back for part three. Some simple exercises you can do if you have migraines or headaches. A couple of things that are real helpful, and they focus on the upper three vertebrae of the neck. We know for most folks who have headaches and migraines that this area here, this base of the skull, these three vertebrae are usually involved. That's because of the blood flow going in and out of the head through these vessels. Some of them go in the neck, and some of them go actually through the spine, and some are in the neck and go into the brain. Some of it is because of the nerves back here. And so we're going to give you a couple of simple exercises, and I'm going to use this little dry spine here to just kind of show how to do it. But what you want to do, exercise number one, is for your first vertebra in your neck, called your atlas. And so what you're going to do is just kind of put some pressure. You're going to use your thumb. So what you're going to do is slide down behind your ear a little bit where there's a little space, and then they'll feel a bone. So you do that on both sides. So you're going to take your thumb right here, and you're going to take both of your thumbs like that. Okay, so I'll show you what it looks like on me. So we're going to go down off of the big bone in my head. That's called the mastoid. You're going to go right in this little depression and right on this bone. And that's called your atlas. That's your C1. And what you're going to do is just going to go side to side. As you're going down, so if I'm going down on this side, I'm pressing with this hand. And I'm pressing with this hand, holding steady pressure, but pressing a little bit more as I go down. Okay, very simple, very easy, very gentle. Don't have to press real hard, don't have to do a lot of other stuff there. Okay, exercise two. This big bone here, hard to see, that's the first big notch after your skull that you're going to feel going down. So this first area here is the base of your skull, and there's this little thing, this little bony thing called the EOP. So that's in the center. You can go down, there's a crevice, and then you'll feel like that bone pop out. So what you're going to do is put your fingers on either side of that bone. This is called your axis. Your index fingers, the pad of your index fingers, and you're just going to turn gently side to side. And you can do a few times each way. You can go back and forth too at the same time, so you can turn. Easy, gentle. And what this does is releases the tension on a lot of the muscles that are going up into the head. The last exercise, and now what we're going to do is we're going to be working on the back of the head here. Okay, so what we're going to do is we're going to reach with our fingers, pads of the fingers, to the base of the skull, just under the skull, and then we're going to take our hands, we're going to lift straight up. So we're just going to kind of pull up based on that. Nice gentle pull, maybe 10-15 seconds at a time, a few times. Don't let your head go back, don't let your head go forward, just keep your head neutral and lift straight up. This too is going to give a gentle stretch to these muscles that are in the back here that have a lot to do with the circulation into the neck and head. Okay, so those three simple exercises that you can do, and then what else you can do is you can also work on during the day just keeping your posture better, keeping your head over your shoulders better. And if you're working at a desk, every once in a while, just get your head up and even do this little stretch or do these little exercises, and you'll have way less headaches because you're going to develop way less tension. Like we said, we know these areas, this top three areas, those are the ones where most of the headaches come out of. They're called cervicogenic headaches. It's estimated that about 80% of all headaches involve this part of the body. So giving some gentle self-care here is oftentimes really helpful in preventing headaches, getting less headaches, getting less intense headaches, and getting headaches that are now not lasting days, but maybe minutes. So if we can do this, we'll have less, we'll feel better, and natural. No drugs, nothing else. So that's it. That's it for our third video. Try this out, and we'll look at you.